So have you guys heard of these secret leaked documents that have come out of Apple regarding their healthcare plans?
Say more.
Yeah, the WSJ article.
Yeah, so the Wall Street Journal published on these leaked documents, it's something called Operation Casper, which sounds very CIA, but it essentially outlined Apple's, or some of Apple's plans going forward for healthcare and some of the things they've tried and failed. So just to zoom out, in terms of motivation, Apple have already conquered consumer tech, right? We know it's a $1 trillion industry. How many more iPhones and MacBooks can you sell? But we know that US healthcare is 4 times that size. It's a $4 trillion industry. Most countries are spending 7 to 20% of their GDP on healthcare. So it makes sense for them to move here. In these leaked documents dubbed Operation Casper, we saw Apple trying to make a primary care service. So initially they started by making it just for their employees, and then they extended it a bit. And they also made this app called Health Habit, which was trying to help people with high blood pressure to get some coaching and improve their behaviors. Internally, it seemed like the data was fudged a bit. So they were getting results that just were so unrealistic. So they were taking people in stage 1 hypertension in the earlier stages of blood pressure and getting like 91% success rates in lowering their blood pressure. I mean, we know this, right? You're never going to get a 90% success rate with something like this. I mean, the industry standard was something like 20 to 30%. So that was the first part. But what do you guys think in general about Apple's play in healthcare? Like, where do you think they should be going? And why do you think they're going to be successful, or why do you think they're going to fail?
I think what Apple can position themselves successfully as is a preventative care kind of watchful guardian role, where they use the monitors, the stuff they sell to kind of watch over your markers, your biomarkers, your vital signs, and then detect any irregularities. The problem with that is that biowearable markers aren't that predictive. They're actually good kind of baseline markers for general health in many ways. So I think they'll struggle there if there's no integration with actual blood markers and other biomarkers that they don't have access to through their devices. But the brand itself, I think, will be a really strong kind of intelligent guardian brand that they can build.
The brand is super strong. I once heard this phrase described that when your Android phone stops working, you think the phone is broken. But when your Apple phone doesn't work, you think you've done something wrong. And that will certainly carry on. I mean, Apple have had decades of this experiential marketing where we've been using their products. We rely on them. We trust them. The other part is also their brand is around not selling your data. So companies like Google have this huge problem where their whole business model is around selling your data to other people. And we inherently just don't trust them. Apple are in a pretty good position where they are trusted, I think.
Yeah, I'd say so. I mean, I think that they're leaning into privacy as a feature, privacy as a selling point. And there was a really interesting release, privacy-centric release, I think a year or two ago, that made this point really well. So that's going to be critically important for people to trust. And if you think about the watch as the kind of foundation of their health ambitions, you talked about the intelligent guardian. A lot of that is based on the monitoring. Like when I look in my health app, I see VO2 max data. VO2 max is an independent predictor of longevity or mortality risk. I see falls detection. I see information on my gait, balance, all sorts of things. And so,
how's it looking? Is it good or?
Well, I interestingly, I think that my if I take my VO2 max data, it's actually fluctuated about 20% over the last couple of years. So up and down.
Does that mean it's gotten worse over there?
Well, it was high and then
fluctuated downwards.
yeah. So I've been waffling a bit, but I think 1 in 5 or 1 in 6 of US residents have an Apple Watch, right? So they're contributing to this information and it's being monitored. And I think actually when they launched the Apple Watch with the ECG, they did one of the largest clinical studies ever done, which is like 420,000 patients or something that they enrolled in less than a year to be monitored with the Apple Watch to look up for signs of atrial fibrillation.
Can we just step back to what Adam was saying as well, though, that this data that Apple have, I mean, everyone just says data as if it's this like one thing. I mean, heart rate data, this predicted VO2 max data, et cetera, et cetera. Is it that useful in any capacity beyond just that's cool? Because if you think of like what an EHR, like, Cerner or Epic would have, they would have literal, every hospital consult you've ever had.
Blood test results and so on.
Blood
Yeah.
test results. Like,
So-
how useful is this?
So there's the consumer health angle, which is underpinned by the watch, which is all the wearable data. The other angle is the institutional angle, where Apple is building like the EHR data aggregation application, which is, I think it's called Health Data or something, which even in the UK, there are NHS hospitals that feed data into the Apple app. And a lot of the healthcare systems in the US now, you can access your hospital records.
The crucial bit is it's a digital health passport. So instead of someone else
Yeah.
owning your data and managing it, you have it on your phone and it's yours. It's like a very different approach, right? It's like user-centric.
Yeah, and then the second thing that they've done is they have the research kit and health kit, where people can basically use some primitives to build apps for use in research settings. And then I think they also have a series of like apps. I don't know if they're widely available or custom built for providers that can be used in clinical care settings for like dictation and entry into an EHR, or for reporting lab results to physicians like Apple Watches. So they've got this consumer like Guardian piece, and then they've got this piece that goes through traditional healthcare services providers or research institutions. So I think you have to look at it from both perspectives. Certainly on the consumer health, I would say that in terms of like access to the population and being a trusted partner and having real wearable data, which includes things like VO2 max, resting heart rate, and so on. And it will soon include probably blood pressure and non-invasive blood glucose readings. I don't think anybody else comes close. Does anybody have more data than they have? I don't know.
Probably not, but where this data comes into effect is their probable partnerships with insurance companies, right? Because large pools of data like this can be used to categorize different people into different insurance plans, and that's how it could be used. So it's not useful on an individual care plan for a patient if you have their heart rate data and their sleep data, for example. This happens a lot where patients kind of complain to me about other doctors where they say, I have all this Oura Ring data, I have all this whatever data, and I've presented it to my doctor or my GP, and they weren't interested. They were just like, I'm not interested in looking at this data. And people are baffled by this because they feel like it's very valuable data, which it is in some context, in kind of in a general health context. But for most medical consultations, this data isn't actually that interesting or useful. But I think when you have millions or hundreds of millions of data points on a large population, then you can stratify people into different risks, and that will be useful from an insurance point of view.
Yeah, and I think one of the underlying trends or the kind of differentiators in the insurance industry is like how well you can risk stratify and price the risk of each individual person. And what Apple has through the watch and the phone and so on is it knows your activity patterns. It knows your trend in your underlying health and well-being. And it also has other data, like it has financial data. We haven't even talked about that. But it's like, they have access to there's Apple Card now, and there's all sorts of payments and things people are putting through their Apple products. So you can probably use that data to create profiles of people and better predict their risk or their willingness to improve their health behaviors and respond to gamification or nudges or what have you. So that's one of the key things in healthcare. That's one of the greatest challenges, is like accurately pricing the risk, because I think in the US healthcare insurance market, profits are actually capped. So you need to like price the risk and the premium for each patient, for each user, for each customer as accurately as possible.
I think one dark horse in all of this is Apple's research kit. So essentially, this is enabling this new concept of decentralized clinical trials, DCTs. And traditionally, a clinical trial, when Big Pharma does one, there's a big center. And we know that they make up, 55 to 60% of the cost of bringing a new drug to market. And bringing a new drug to market, by the way, costs upwards of $2 billion. So this is a really, really big industry ripe for disruption. And we saw this with the Apple Heart study, Imran, that you mentioned, where they enrolled 400,000 people in a decentralized clinical trial. if they're able to offer this infrastructure to researchers, not only from the perspective of reducing costs, but also just from the perspective of great science being done, it's really, really promising. I mean, in the pipeline, they've got Apple's women's health study. They've got this Apple Heart and Movement study. They actually got this investigator support program where any researcher can get free Apple Watches for their academic studies. So they're really, I think they're trying to do some good as well in all of this.
I think we might be overestimating the cost of clinical trials there. The real cost in bringing a drug to market is not just the drug that succeeds in getting to market. It's all of the failed drugs that die along the way that contribute a lot of that cost. But you're certainly talking in the tens of millions per trial. The other thing that Apple has there, which is a real problem in clinical trials and should be relevant to the three of us, is diversity of trial participants, because most trial participants...
Adam's favorite topic.
Yeah, Adam's favorite topic. Most trial participants are not that diverse. They certainly don't reflect the population. I think they're like clustered around the northeast of the US in the American context. They tend to be Caucasian, etc., etc. So they'll have access to a much broader set of the population. Whether they can translate that into actual recruitment is TBD. But I think that's also the foundation of CVS's play in clinical trials. And I know there are some other companies, Walgreens and Walmart, are now moving into clinical trials as well. And of course, they serve everybody, right? They serve the entire population. So there's an opportunity there to recruit people in across all demographics and ethnic groups and so on.
Well, actually, Adam, let me get your thoughts on this. So this was part of the secret report that I mentioned, Operation Casper. But one thing Apple were making for their employees was this app called Health Habits. And essentially, this was the coaching thing I was talking about, where they take people with high blood pressure, give them some coaching, and try and reduce it. Now, the two controversies were that they reported results that were so out of line. I mean, I'd like to get your comments on that. Like 91% of people improving their blood pressure. That just seems outlandish. I mean, I don't think we've ever experienced that. The second thing they found was that they really struggled with retention and stickiness and engagement of this product. So they found that people just weren't continuing to use it. I mean, this is a pretty common problem, right, in all of this digital coaching sphere. It's really hard to do even for a company like Apple, right?
Yeah. I mean, first of all, the typical Apple employee is not probably representative of a general population. So and especially if you're trying a product of Apple that is being offered to you as an employee, the retention is probably going to be really high, right? Second of all, I think there are lifestyle interventions that you can do to improve blood pressure within those ranges. But the issue is, as you said, the issue is, will people stick to them, and connecting those behaviors to the app. So, for example, if an app tells me that I need to do 30 minutes of Zone 2 training 3 times a week, I might be doing that, but does the app know that I'm doing that? In Apple's case, they probably will be focusing on things that they can measure, that don't need the person to kind of log in their activity. And that's a big issue with kind of coaching apps, is that people tend to stop logging their activity, stop logging their adherence.
Like MyFitnessPal.
Yeah.
Classic example. Everybody's tried it and
so for example,
been lost
one of the interventions that we used for sleep at Span was we would ask people to go for a walk in the morning and get light exposure, right, in the morning. So to kind of reset your circadian rhythm. That's like a very...
Did you watch Andrew Huberman?
Yeah, exactly, yeah. But it works. So we would have their activity data from Apple Watch. And we would see if they go for a walk at a certain time. We would just use that as a proxy for going outside and getting sun exposure. And we would use that as adherence. So that was one of the highest adhered to interventions that we would prescribe to people. But if you ask someone to take some kind of supplement, or you ask them to log their food, or anything that needed users to actually log their activity, was really low retention.
Yeah, you need basically passive data rather than actively requiring the user to enter it. Have you guys read this book called Hooked by Nir Eyal? He was the guy, I think he was at Facebook in charge of their growth and making the apps as addictive as possible. But he said, hey, let's use all these techniques we've been using to addict kids to these things and apply them for good. And he put the manual out into the world. I think the really interesting bit, I'd be curious to hear your thoughts on this, Adam, was around using variable rewards. So this is like the slot machine example, right? Where you don't get the payoff every time. It happens very occasionally, and that actually releases more dopamine. I wonder if these health companies and all of these longevity apps or whatever, they need to start employing more of these dirty like TikTok gamification slash, this hardcore addictive behavior loop techniques, because they're doing it for good. The ends justify the means. And I don't know how much of that goes on.
Yeah, I think it's really difficult because just the core motivation, the core use of the reason why the person is using this app is just fundamentally different than entertainment apps.
Yeah, that's true. Imran, where do you think Apple should be heading? Where do you think there are some interesting opportunities in healthcare?
Good question. So the challenge that Apple has is that if they do something, they kind of need to build for everybody. We've already discussed like 50 million Americans, 1 in 6 are using the Apple Watch, and they're distributed all across the country. And, they're like of all different walks of life. So what can they do that will meet everybody where they are and turn them into a potential customer? So I think that's one of the constraints that they have. And so I'm actually not that strong a believer in the provider playbook. I personally don't think it's that viable for Apple to spin up telemedicine primary care clinics across the country. Just think for a second, like what would it actually take for them to provide a provider service across the US? I mean, it's possible, but it's incredibly capital intensive and it's not very scalable. Okay, people say like it would use your FaceTime application, and which is very secure, very familiar to people to have a doctor's appointment and so on. But I just think that that's a very difficult business to pull off. And, they do have the retail stores as a footprint, but to say that they're going to then transform their retail footprint into some kind of care provision footprint, I think is a stretch. I think that the Apple Card, the credit card, is kind of an interesting example because of their recent products. That is, I think, one of the more ambitious ones, their services, I should say. Obviously, the headset is the big news recently, but the Apple credit card, which they launched, I think, with Goldman Sachs in the last few months or last year, is basically like a zero fees credit card, 2 to 3% cash back, something like that. Even has like a buy now, pay later thing, which is, with no fees over like 4 installments over a few months. Just since launch, it's basically one of the most attractive propositions for consumers and moves them deeper and deeper into financial services. So I think health insurance is an interesting angle. The challenge there is that health insurance companies, the startup ones, have really struggled. If you look at companies, and maybe we can pull up some of the stock charts. If you look at the healthcare insurance companies, like the startups that have really sort of broken out, Clover, Oscar, Bright Health, these companies have seen huge slides in their share price in the last couple of years. Many of them are down like 90 to 95% on where they were at their highs. And it's an industry which is really dominated by incumbents. So I don't understand really the ins and outs of how they would do this. You do see the traditional healthcare insurance companies like Humana, United Health, Cigna, and so on. They're actually doing quite well over the last few years. They're seeing growth in their share price, but the startups are sort of deflating. So I think it's difficult for anyone to break in.
That's a really good point. Do you think this is an opportunity for one of these startups to be bought by Apple? I think Oscar would be a good acquisition by Apple.
Maybe, and they've been moving closer and closer to health in different ways. Like I know that Alex Gorski, the previous CEO of Johnson & Johnson, joined the Apple board. So they're like connected at the very highest levels. A company like that, of course, would be. But if you think back to like how they could do, how and why they would be well positioned in insurance, first thing is the privacy piece. The U.S. healthcare insurance is 1/4 of the $4 trillion healthcare market. So it's $1 trillion market. So it's the same as basic consumer tech, which is what you said earlier. You said about $1 trillion. I don't know. Is that what you said, Musty?
Yeah, I said that. That's correct.
Yeah, worldwide or U.S.?
U.S.
U.S. Okay. So it's of the same size. Secondly, all of the brands there, like nobody likes, from what I understand, their health insurance company, right? Thirdly, they're notoriously crap when it comes to user experience. They're impossible to navigate. They're not trusted by and large because the way that they make their money is by denying you your claims oftentimes and, just preserving some of the margin on your premium. And there are pockets of personalization, like Vitality has given people Apple Watches and so on to track their behavior and incentivize them and create commercial partnerships where you go to the gym, you get a free coffee, which is probably calorie-wise net positive transaction for most people. But they're really well positioned. They've got the health data, they've got the personalization, the gamification, they've got access to the EHR, they've got the financial ambition. If you look at what they've done with the credit card, the ambition is there to like bite off huge chunks of the consumer, needs, right? And so I think that health insurance is more scalable, it's more applicable to everybody. I think it just makes more sense becoming a provider.
Really interesting is, I remember in the early days of Deliveroo, Uber Eats, do you guys remember when you ordered something and the order was wrong? If you wanted a refund, it was like a one-click thing. It was so easy. Yeah. And that was then bringing really good UX to stuff. I do wonder how much of this insurer model and, these clunky interfaces, everything being difficult, I do wonder if you brought Apple-esque UX to this, how...
Destroy the profits.
Destroy the profits. Like if it was like one click, like I can just
claim
claim
the user experience is how they made their money. No, I don't know. So again, I haven't interacted with a lot of these businesses, but certainly where there's a friction, like it's so easy to buy. This is my biggest frustration as a consumer is it's so easy to buy certain things, so hard to get refund. Think about your mobile phone. It's so easy to start a contract. It's a nightmare to get any money back. And I think that there's probably a bit like that in health where there's just a friction and people just don't bother, the $10, $20, $30 here and there that they're owed. I don't know. This is a bit cynical of me, but yeah, I think that ultimately though, I think that if they provide a better service and they have the technological software, hardware know-how and the sophistication to like build a much better user experience, I would say in anything they put their mind to. So I think health insurance is the next bet. I think we're going to see it quite soon. I wouldn't be surprised if it comes in the next year or two. It touches on the financial ambition, it touches on the privacy, it touches on the health data, the personalization, the gamification. It's just so many, I think, tailwinds there, and it's a huge market. I think it makes sense for them. It's not going to be like digital therapeutics, even clinical trials. Like it doesn't really make a lot of sense for them to like be a big player in clinical trials. I just don't buy it. I think the provider angle is too complex and frictious. And I think Amazon is going after maybe with One Medical, some angle there. All
of the big companies are doing it.
Yep.
Google, Apple, Facebook, Amazon, they're all realizing how big healthcare is and how ripe it is for disruption.
Yeah. I think they need access to clinical environments because they need to do the type of research you described on reversing hypertension and developing their own applications, understanding what's possible. And for them, a 50, 100, 500 million bet in that space to like do some R&D is not a big deal. So I think that that's probably why. And also they have such big employee populations that, having their own medical service as an employer is like, makes sense, right? But to roll that out to 360 million Americans is a totally different thing.
Wait, Imran, let's rewind on your comment where you were saying that it's a bad idea for Apple to become a provider. So say you get the call from Tim Cook, he flies you over and you have 10 minutes with him in a room to convince him that becoming a provider is a bad idea. Like what, you didn't really expand. Like why do you think that is a bad idea for them to directly be providing care?
Because it's not scalable, because it's operationally complex. You're hiring clinicians, you're developing a huge geographical footprint, you're entering a highly regulated arena. And I just think provider businesses, I don't know what Apple's profit margin is, but I don't know that a provider business will be necessarily a highly profitable, unless you think that the time is right for them to go with some real technologically underpinned solution where they're changing care provision and it's all like software and LLMs and something else happening there. Maybe there's a play, but I just think it's incredibly complex. Why would you start there? I don't know why you would start there.
And is there a route where you partner with existing providers? Is that more promising?
So I think they're already doing that with the EHR integrations. So their starting point, like a lot of what Apple does is very stealthy. I don't mean that in a kind of like a creepy sense, but I mean like it's happening in the background. Yeah, you look at what's happening with the watch. Like the form factor doesn't change, but over time they're adding more and more and more data, and it's like very subtle and so on. And so with their healthcare provider play, it's the same thing. I think there's like the integrations that are being built to access more and more of the EHR network, the EHR system. There's the health kit, which is, spinning up applications which I think are branded and sponsored by their clinical partners rather than Apple's big entry into healthcare. So that's not a very good answer, but
I don't think you'll be hired by Tim Apple anytime soon.
No.
No, I totally agree about the being a healthcare provider is just super complex.
Tim can't afford me.
Yeah, the margins are so low. I don't see how someone like Apple can transform that experience in a meaningful way that is in line with the Apple brand, but also it will be super exposed, right? So this will be something that people will be interacting with. There will be news articles about it. There'll be posts about it. So unless they get it right and 10x the experience in some fundamental way, I don't think they'll go into that. I think their biggest play is going into insurance.
It'd be terrible for their brand, right? That they're providing care. There's a big Apple logo here, because how many people have bad experiences with their hospital care? And how many people die?
No one loves their healthcare provider, because you only get in touch with your healthcare provider when you hate yourself and life. You want to feel better.
Healthcare providers, I think my understanding is they're just not as profitable historically, not as consistently as profitable. I think that healthcare insurance companies are consistently increasing in their share price in the US, and they've been consistently more profitable, right? And they're the smaller number of larger businesses that dominate the US market. So it kind of fits more probably with the type of ambition and the type of role that Apple would want to play in the future in that ecosystem. The big healthcare insurance companies have actually grown in their share price over the COVID period. It's anywhere between 20 to 75%. The startups in that same period have tanked. Oscar, Brightline, Clover, these companies are down 80 to 90%. So it's a difficult market to crack. It's dominated by incumbents. But I think Apple, if there's a company that could crack it, Apple, amongst the tech companies, is probably up there with everything that we've said so far on their reputation, their data, their access even to a higher socioeconomic group, because Apple product users tend to be probably more likely to be employed, middle to upper socioeconomic classes, more interested in health behaviors. Provider networks are just tremendously complex, operationally complex, as you mentioned, Adam, and they have not fared well over the COVID pandemic. A lot of provider networks actually were very challenged because they lost their patient flow during that period. And, in markets where you're getting paid to deliver services, they've just not done that well. So I think insurance is a complex, but it's I'd say more attractive market for a company like Apple. It's more scalable and also more in line with all the other financial services they're starting to offer.
So I agree with that, but there's also a shift in consumer kind of behavior towards healthcare subscriptions, which I think Apple can play a role in. So this whole idea of paying a monthly subscription that covers certain aspects of healthcare, and where you receive tests or you receive continuous care, this is becoming more and more popular within healthcare startups and the healthcare industry. And people who use Apple are more likely to be consumers of these kinds of products. So there might be certain verticals that they can go into, insert themselves, especially in preventative health, things that don't require urgent care or the primary care stuff that is difficult to scale.
Why would they pick off a small specific vertical of health and start offering testing service? That would just seem weird.
I don't think preventative health is a small vertical, though.
Isn't it? I've heard that 95% spend is on acute stuff, and then only 5% is into prevention. No,
I think it's getting bigger as well. It depends on how you. Yeah, it depends on how you define prevention.
Tell us about your startup, Adam. We haven't heard about it before. So I don't know. I don't buy it. I don't think that they're going to pick off. I don't think there's going to be an Apple Health panel. Yeah, that all the 18-year-old, 16-year-olds that buy a new iPhone will be offered. I don't buy it.
I disagree. I think there is a play for them there, and I think they'll probably do it well.
Wait, explain this. This sounds ridiculous.
I think that as part of your
buy
Apple
Numenor.
Health,
I think they're going to buy Numenor.
you will have
Get the
No,
checkbook out.
you'll have a general health checkup yearly as part of your health of your Apple Health subscription, and that will be integrated with provision of care based on your
Okay.
data. I think it's a huge market that is very different than our current model of healthcare.
So you
Okay.
basically, what you're paying for is like a health check where you fill in some forms, you get sent something to your house, you swab yourself, you catch some poo, send it back, and you get like a annual health check from Apple.
Yes, and then you have
They
a
could probably-
continuous part going with your Apple Watch. You have your
If you see how gross
continuous
some people's laptops are, they can
monitoring.
probably do some like body fluid sampling from your keyboard.
Do you guys want to? Shall we finish off on some feedback? We've got quite a lot actually.
Sure.
So we got a really nice comment from Nick Heath saying, as a person in health tech, the view count to insightful discussion ratio is crazy on this pod. Thanks for sharing. That was really, really nice, actually.
Yeah,
Really like that.
that's
There's even
very nice
saying
one.
lots of good discussion, but not enough views,
Yeah.
Yeah,
basically.
But that's good. Undiscovered talent. Then Nathan Nikoloff said, enjoyed this, guys. You all speak really well. And Adam and Imran create a fun dynamic. I think that's true. I think you two have a cool, you're very different people. So I think it improves
People
the
want
vibe.
some fun. I'm going to give you some fun. We logged on at 8:30 this morning for the podcast. Texted Adam because he was late. And he's like, oh, crap, guys. I thought it was this evening. Now, a few times in the past, we've let him off. This time, we just started abusing him on WhatsApp and saying, you better get your face in front of a camera in the next 10 minutes. Otherwise, we're going to ditch you.
This is all behind the scenes.
Yeah, all behind the scenes.
No, but he's come up and put on a really spectacular performance once again.
Yeah.
So-
He's got a bit of Wigovi face, but it's okay. I think we all have it this time of the morning.
I think there's not enough spice without Adam. I think
Yeah.
it's too dry.
Yeah, I'm a bit dry this morning. Sorry.
No, I mean
The
you
more
do.
you
You normally add the spice.
The more you sleep, the more spicy you become.
Then we got a comment by Shem Wadowski saying it'd be great to learn about ideas basically in medical cannabis, and asking if we're planning to create any episodes on that. And I guess related to that, there's the psychedelics industry. Not something I know a lot about, but I think it's an interesting trend in health tech. So maybe we could cover it.
There's a headline news story about Australia, I think, using psychedelics, creating therapy, some kind of therapy or pathways with psychedelics. The other thing, so I appreciate the feedback. The other thing that's interesting is in relation to another previous episode we've done, not so much on feedback, but just kind of seeing how things play out, is that the Babylon deal that we anticipated of them being taken private by Albacore, I think has been executed, and they're going to be, their assets are going to be folded into a company called MindMaze, which I don't know much about, but it's like a Scandinavian company, digital health company. So Babylon, as we know it, I think is basically no more.
Yeah, very sad. But the silver lining was that we got a banger episode out of it. So swings and roundabouts.
Cheers, lads.
Content. Last two bits of feedback. So Rohan D'Souza from PwC said, love your podcast. Looking forward to this one. And then we got a shout out from Rosie Barnett at Delin Ventures. She was on the 40-Minute Mentor podcast and he asked for her recommendations. And I scrapped down what she said, but she basically said this podcast is really great. And she described this bit as informal, sort of youthful discussions around companies / trends in healthcare. So I like that.
Youthful. I should play it to my kids more often.
Youthful as in ill-informed.
Yeah. All right, guys, nice one. This one was really good. I enjoyed this. Yeah, we'll do it again soon.